All right, welcome everybody. Thank you so much for joining us on this episode of Weekly Dose with Dr. Ude. I am so excited. I have one of my friends and colleagues here today. She's actually a gastroenterologist and she is making time out of her busy schedule to be here with us today. So I'm very excited. It's going to be about Crohn's disease today. Now, before we get into what I have for you today, I'm just going to start with introductions. For those that don't know me, I'm Dr. Ude. I'm a board certified family medicine physician. I'm based in Martinsburg, West Virginia. I own a primary care practice, namely Apple Valley Family Medicine, and I also own an aesthetic practice. My goal is not only to have my patients feeling good, but looking good. So now with that out of the way, I have Dr. Matilda Hagan. Um, and she's here with us today. I have known Matilda since college,
Oh,
right?
yeah, indeed.
It, it's been a long time, and she is the best. I mean, we don't get together as often as we should. So I am so excited about this. So let me give you information professionally for Dr. Hagan. So she's board certified in gastroenterology and hepatology with a subspecialty in inflammatory bowel disease, hence why we're talking about Crohn's disease. She is a medical co-director for the Center for Inflammatory Bowel and Colorectal Diseases at Mercy Medical Center. She's also the site director for Mercy Clinical Scholar Gastroenterology and Hepatology Fellowship Program. Dr. Hagan, thank you for being here with us today.
My pleasure. Thank you for having me.
I love it. All right, so we're going to get right into it. So the topic is Crohn's disease. So, Dr. Hagan, what is Crohn's disease?
All right. So Crohn's disease is one type of, what we call idiopathic chronic inflammatory bowel diseases. And then, just to define it, you kind of have to explain what it is, right? So it's felt that the body gets exposed to something in the environment, whether it's food or an infection or medication. It's unclear, but whatever this exposure is, it causes the immune system to respond in people with particular genetic susceptibility. So what does that mean? It just means that the immune system's response, we say that it's aberrant, meaning that it causes the body then to attack the lining of the intestine. The key distinction between the inflammatory bowel diseases are the area where the disease affects. So for this episode, with our focus on Crohn's disease, essentially you can have inflammation from essentially the mouth to the anus. And so the presentation can vary based on, the person and the sites affected. Small and large intestinal, location of involvement is quite common, and so depending on again where in the body it affects, a very common presentation, of course, is abdominal pain, and people can get also changes in bowel habits that can go along with that, and that could obviously, and we can get into that even a little bit further in a few minutes. So.
Yeah, so that actually was going to be my next question. So what would be the symptoms? You kind of started touching on them. So what are the symptoms that people with Crohn's disease have?
Yeah, so I mentioned abdominal pain being a very common presentation, change in bowel habits. So some people commonly they can have diarrhea, and the diarrhea can be bloody or non-bloody. Depending on the age of the person, and again, the sites affected, you could have weight loss, you can have constitutional symptoms such as, fever. You can have, nutritional deficiencies, like, people could be anemic or have B12 deficiency. If they have what we call perianal disease, they can present with abscesses around their anal area, or they can present with, paper cuts. We call those fissures, or even fistulas, which will be abnormal connections between the gut and the outside of the body, and those are can show up with pockets of pus or even drainage. People can have trouble swallowing or abdominal pain after eating specifically. So there are a whole host of symptoms that can occur with this, and so it's really important that if you're having any symptoms that would be concerning for such a thing, that you get evaluated.
So the other question is it hereditary? So is it inherited through family?
So there is a genetic component to it. It's not a perfect inheritance, meaning just because a parent have it, it does not mean that their child would have it. And percentages vary. Actually, even within identical twins, we can have one twin have, clinical manifestations of Crohn's disease, and the other twin does not. And so it really, again, an affected person has to have genetic susceptibility. So that is a requirement. But just because you have a genetic susceptibility does not mean that you would, invariably develop clinical symptoms of the disease.
Okay. So the other question is, what are the complications from Crohn's disease?
Yeah, so I mean, again, complications can be many, and most of it would stem from either, inappropriate diagnosis and or treatment. But the common things are, I mentioned, the vitamin deficiencies that can occur. You can also have, a need for surgery, for example. So, if somebody has pretty significant disease, they can have narrowing, right? So I guess taking a step back, in terms of Crohn's disease, we typically will, kind of categorize the patients as having an inflammatory Crohn's disease, which is basically inflammation in the lining. And then the second category would be, say, stricturing, which would mean that there would be narrowing or strictures along the intestinal lining. And those people can show up with, a blockage in the bowel, for example. And then, there's what we call penetrating Crohn's disease, which is when people show up with, pockets of pus, and that could be an intra-abdominal abscess or a pocket of pus that collects in the abdomen because there's a tear true and true in the lining of the intestine. So some of the complications can be just that. You can show up without any previous diagnosis with what may seems like an acute appendicitis picture, and it may turn out to be Crohn's disease, or you may end up with, a pocket of pus in the abdomen or the pelvis, or you can end up with a bowel obstruction, or you can have, severe just malnutrition, malnourishment, severe weight loss. All of those are considered complications. And then just, having, even if it's just inflammatory and having diarrhea, several times a day, again, you can have anemia and other potential complications related to that. Some of the things that can also happen as a result of Crohn's disease would be what we call extraintestinal manifestations. So you can have eye disease as a result of that. You can have episcleritis or uveitis. You could have, joint disease as a result of that. So people can have debilitating, joint pain or swelling that needs to be addressed. People can have complications related to liver disease, specifically primary sclerosing cholangitis can go along with Crohn's disease. So someone may have presentations sort of consistent with that. And, we may find that they have inflammatory bowel disease as a result. So again, there are many manifestations of the disease is sort of the bottom line. And it's important that you get the right kind of care from the outset and the right diagnosis to start even before the care. So.
Yeah, so definitely lots of complications there. So when you get involved as the specialist, when someone comes to see you with Crohn's disease, what's the expectation on what's going to happen?
Yeah, I mean, I think one of the first things I like my patients to understand is that it's a partnership, and that our ability to be successful relies greatly on you communicating, following up with your physician, and also being involved in the decision making regarding your health, because that's the way that we're most successful. The other thing is also helping patients understand that you didn't do anything to kind of get this condition. So it's not, most people are like, well, what did I do? What did I eat? Like what happened? Like how did I get to be in this position? So there's really nothing that you did. Like I said, it's a genetic susceptibility coupled with exposure in the environment that's not yet identified, and then it's the immune system's reaction to it. There's some role for the microbiome along that, but again, the first thing is to understand is that it's a chronic condition. You didn't do anything to get it, but being able to control it relies greatly on a partnership with your physician. And then in terms of, how do we, work to make you better, really depends on your presentation. What are your risks in terms of potential for complications in the future, and what's most appropriate in terms of what you'd like as far as treatment is concerned, and what is, what's important to you in terms of your personal values.
So the other question I always ask when we talk about disorders on this show is, I always ask about any practical tips that you would have for patients in general. Are there any practical tips that patients can practice to help, either minimize symptoms or help them along with this disease process?
Yeah, I mean, so, at the outset, if you have symptoms, getting to the appropriate provider is important. So, the first thing is, of course, getting a correct diagnosis. That's critical. And then in terms of, what happens thereafter, so self-care is important. So, basic things that you think to do, like making sure you're optimizing your nutrition. People tend to avoid foods because it makes them feel bad, or that they read that I can do this diet and somehow I won't need medications for my disease. So again, diet is important, but it has to be within reason to make sure that you're not malnourished. Keeping your appointments, making sure you get on the right medications, because it's very rarely that people can get through this without medication. So that's an important thing to kind of keep in mind. And those are, I'd say for starters, those are some of the things that I would say would be important to keep in mind.
That's so awesome. Okay. So thank you so much for all the gems you're dropping today. So I'm going to switch gears. I always ask docs um, why they do what they do. So Dr. Hagan, why do you do what you do?
Oh, well, I love what I do. I guess that's really why I
Okay.
do. Of
Hmm.
course, we you mentioned that we go way back, and obviously
Hmm.
we made this decision to embark on this journey, and very grateful to have been able to get through it to get here. But I mean, it's I do what I do because it gives me purpose, right? Like something that makes me excited to get out of bed, to be able to be useful to my fellow human beings, and yeah, I mean that's it. Bottom line. That's why I do what I do.
And so many people are benefiting because you decide to do what you do. So thank you so much. So let's see. So Dr. Hagan, for people that want to know more about you or want to connect with you, where can they find you?
So, as you mentioned, I work for Mercy Medical Center in Baltimore, Maryland, and I have clinics all over the place through Mercy. So, typically, the Mercy Medical Center website would be a way that they can locate me if they so choose. So.
That's perfect. So, guys, you heard it from the expert. So, Dr. Hagan, thank you so much for being here. So, guys, I know this video was very helpful because she dropped a lot of gems. So, please like it, share it with those that it will help because this is definitely information that can save a life for sure. And then if you're looking for a quality primary care physician, we're accepting new patients at Apple Valley Family Medicine. Our phone number is 304-350-1087. And our website is www.applevalleyfamilymed.com. So we will see you on the next episode. Thanks for tuning in. And Dr. Hagan, thank you. All right, bye.
Much for having me.
Thank you.